Hey everybody, this is Dr. Elhiani and I'm here to talk to you about a patient we're seeing. Her name is Dorothy. She's had a wound on her leg for about 20 years. She has bad diabetes and vascular disease. She also has what we call venous disease. So her veins aren't working well and her arteries aren't working well. To top that off, she has the diabetes. So she has three things kind of working against her. What we're doing today is wound care. Wound care is very important to help close and heal chronic or wounds that have taken a long time to show any signs of healing. Dorothy's case has been brought to me because she had been mismanaged by several doctors over the years. We are treating her now, and we plan to do what's called a split thickness skin graft. We plan to really clean up that wound and take a piece of her skin from her own thigh and put it on her foot and ankle. Good morning, Dorothy. How are you?
How was your weekend?
My weekend was great, Dorothy. Good to see you again. When we have chronic wounds that are stuck in this chronic state, meaning they're stuck in this delayed wound healing, what we need to do is, be aggressive about treatments. We need to debride it. We need to clean it with a blade. So I always give the analogy that debriding a wound is like pulling the fire alarm in your body, okay? When we stick a blade to it and we get some blood flow, that helps kind of recruit all the white blood cells and all the different healing factors that you need to help close a wound, okay? So let's get started with the debridement today, Dorothy. We're gonna lift you up here. Good, good. All right, and how often are you changing this, Dorothy? You changing your dressings? Every day. And you're getting a lot of drainage from the wound, or?
No, see, just a little.
Just a little? Okay.
A whole lot less than what it was before.
Less than what it was. Okay, good.
And the pain is not as intense as it was, so.
Okay.
I'm happy.
You're happy we're in a good place?
Yep.
Good. We talked about doing what we call split thickness skin grafting. I know you've had it before, right? We talked about taking a little piece of skin from your thigh and putting it on this area, okay? The goal is that your native skin from your own body, will take better than skin from another person's body or even stem cells from a different person's body.
Yeah, okay.
So putting your own skin will help close this wound a little quicker, okay?
Okay.
So first things first, let's cleanse the wound with a little bit of saline. And we clean it up a little bit. And then we do what's called a debridement. So on top of a wound, we have what's called the biofilm. Biofilm is a little bit of bacteria mixed with some of your body's native tissue that kind of delays healing. So when we scrape a wound, we're cleaning off some of that biofilm. All right, so let's go for it. Dorothy, you let me know if this is painful at all. We'll start very gentle and slow here, I know. Dorothy's a trooper. You okay, Dorothy? All right. So as you can see, we've got some early blood flow here. You see how the tissue's starting to bleed. It's exactly what we want to see. You doing okay, Dorothy? Good. This part's looking a lot better also. So as you can tell, we got a nice bleeding granular base. Dorothy, you feeling okay?
Yes.
Not too painful? No. We're gonna clean with a little peroxide here. So if you come close, you'll notice that the blood will kind of bubble a little bit. It's the hydrogen peroxide reacting with some of the blood. Hydrogen peroxide helps kind of remove some of the bacteria and with the bioburden. And we'll finish off with another saline rinse. Kind of get some of that off. Okay. So we use a product called Fibricol. It's a collagen product. Collagen is in all of our skin cells. It's one of the main ingredients to help form new skin. So we put this, I call it cotton candy, but it's called Fibricol. What it does is it helps stimulate ingrowth of new skin across a wound. So it kind of looks like cotton candy and acts like it. So what I'll do is I'll tear a little piece here and we'll just kind of conform it into the wound nicely. So make sure all those surfaces are nice and covered.
Going down, so he got
You got down that quickly? I'm proud of you. Good. So when a patient has a higher hemoglobin A1C, right, your risk of wound healing, right, is delayed and it's a lot slower. So what we want to do is optimize a patient, right, from their hemoglobin A1C. And what hemoglobin A1C is, it's a measure of your blood sugar over the last 3 months. So we got that measure of sugar over the last 3 months. That means Dorothy's been behaving. Dorothy, I'm proud of you. Good job. So Dorothy's veins aren't working the best, right? When our veins have one-way valves, okay? When you have vein disease, those valves are either spaced too far apart or those veins become incompetent, meaning they collapse. So what happens is all the fluid kind of collects in the legs and starts pooling in the legs. And this discoloration and some of the wounds that she's getting is because that fluid has nowhere to go. And Dorothy's been doing a good job of keeping her fluid, you know, under control. She's taking the water pills, right, Dorothy? Good. So we're taking our water pills, we're managing the fluid. Dorothy's monitoring her salt intake. We're keeping all these factors at bay to kind of help Dorothy heal and have the most optimal wound healing environment. And what we're doing now is we're applying a multi-layer compression dressing, okay? So we want to help squeeze some of the fluid back towards Dorothy's heart. The fluid that's collecting in her legs that's causing the problem is unfortunately, you know, exacerbating or worsening her wounds. So what we do is we put on this compressive bandage. This is called Collagen, to help squeeze some of that fluid back towards her heart. And the goal is to keep her legs kind of less swollen, and in turn, that'll help her wounds heal. All right, so normal blood sugar, you know, in a person who is non-diabetic ranges between 80 to 120 milligrams per deciliter. That's just the amount of sugar that's in your blood at any given time. Dorothy's actually perfect. She's 115, she's within the 80 to 120 range. She's doing excellent. When you're diabetic, you know, your liver and your pancreas, it's an organ near your liver, starts to poop out and it's not making enough insulin. So when you're not making enough insulin, your sugars tend to go above that 120 mark. So, you know, thankfully Dorothy's been behaving, right? Dorothy's been eating better. Dorothy's been taking her insulins more appropriately, beautifully. And now her blood sugar is great. And her A1C is 7. 7 for a chronic diabetic is a great number. Okay, so Dorothy, you did a wonderful job. So we just put Dorothy in her multi-layer compressive dressing and her boot, and she's ready for surgery. We're planning on taking her next week, and we'll see how that goes. Thank you so much for watching this episode. Be sure to subscribe and follow me at easyfoot.com.